All right, so I still have a few more people trickling in, but I figured we'd go ahead and get started. And we have some students who are doing some early college high school work through Elgin High School who might be trickling in just a little bit late due to testing and some other classes that are going on right now. But I want to just take a moment to thank Ascension Seton and Stephanie Creech for joining us today to talk with us a little bit about nursing careers. And we started this interview and speaker session last year, and this is kind of a continuation of some of the work that we had started then. And this is coming to you as a combination uh, of resources and people organizing this from Ascension Seton, Region 13, and Workforce Solutions Capital Area. And Stephanie is going to be talking with us a little bit today about nursing careers, and I'm going to be your moderator. My name is Josh Mitchell. And what I'd like to start with right now is just a quick kind of overview of our agenda for our speaker session today with Stephanie. And then I'm going to go over just a few Zoom expectations. And then Stephanie is going to do a quick presentation where she talks about her experience in nursing careers. And then I have some moderated questions that my students from Elgin High School helped me put together to learn just a little bit more about the opportunities that are available in nursing careers. So with that being said, let me go through our Zoom expectations, and then I'm going to turn it over to Stephanie to talk us through her experiences in her career thus far. So for today, just know that this video is a live recording. I'm capturing a recording so that I can share it with Workforce Solutions Capital Area. And the goal will be that they will publish this on the Climb the Ladder CTX website to share with other job seekers and students in the Central Texas region. If you don't wish to be on camera and you definitely don't want to be on a YouTube channel, please just keep your video off and just stay muted. I've only got one picture pulled up right now, which is Stephanie. She is pinned to the top, so you will see her speak, but no other camera feeds will come in during our time today. Everybody should be on mute. If you find yourself off mute, if you could help me make sure that you do make that quick correction and click that mute button to cut down on some of those background noises that might be happening. And if you have a question, there's a couple ways that you can pose these questions to Stephanie about nursing careers. One is that you can put your question into the chat box and I will capture that and I'll make sure that I address that toward the end of today's session. Sometimes we might be talking through something and you say, wow, I have a really good question right now, and you don't want to forget it. So take a moment, you can craft that out in the chat box and I'll definitely come back to that in just a little bit. And then finally, at the end, of course, I'll leave about 10 to 15 minutes open for you to ask any questions that you may have for Stephanie about her career thus far as a nurse. So with that being said, I'm going to turn it over to Stephanie. I'm going to stop sharing my screen and give Stephanie the option to share hers so she can tell you a little bit more about her career.
Awesome. Thank you so much, Josh. I appreciate it. Okay, let's see. I'm going to share my screen.
We can see it. That looks good.
Okay, perfect. Thank you so much. So I'm going to spend the next little bit just kind of talking to y'all about what it takes to become a nurse, the different educational paths you can take to become a nurse, and just kind of walk through my career because my career is not an atypical career. It just kind of shows you the flexibility that can happen within the nursing world and how if you don't like being in one place, you can always move to another. And that's one of the wonderful things about this huge population of healthcare associates and nurses. So let's go ahead and get started. Okay, so just a little bit about me. I was born and raised here in Central Texas. I grew up in Cedar Park since I was like 3 years old, went to Cedar Park High School. I graduated in 2002, so I can tell y'all how old I am. I'm almost been out of high school for 20 years, which is really difficult. When I was in high school, I was on my dance team. I took several health classes. And I struggled internally with what did I want to be when I grew up? Like, did I want to be a teacher or did I want to be a nurse? I really liked helping people. I also liked teaching. And I also thought that healthcare was just really cool. So I ultimately chose being a nurse. And that was for several reasons, like I said, for the reasons I just said, but also my parents were very influential on me at that time. And they were like, Stephanie, we want to make sure you have a really flexible career and that pays really well. And so they had a heavy hand in me deciding to become a nurse as well. But ultimately, I'm really glad that I made this decision. So my path to becoming a nurse, I had to go through nursing school. So right out of high school, I knew exactly what I wanted to do. I started taking classes at Austin Community College. And you have about 1.5 to 2 years of prerequisites that you have to take. So I took those. Then I had to sit on a waiting list for about 1.5 years before I actually got into nursing school. So finally got into nursing school, and I received my associate's degree of applied science in nursing, that's abbreviated ADN. While I was in school, I was involved in my Student Nurses Association, and I was president of that for a year. We got to have lots of experiences within facilities. We took care of adults, we took care of kids, moms and babies, and we also had some experience in a mental health facility. In order to become an RN, so I got my degree, okay? In order to become a registered nurse, which we abbreviate RN, you have to take a test called the NCLEX. I have no clue what that stands for. I don't know that any nurse does, but you have to sit for this. It's kind of a tough test. They have lots of review courses for you though. So you take that and you become a nurse. And so I finished all of that in May of 2007. I did start working at this point, but again, it is not uncommon for nurses to go back to school to constantly advance their education. I mean, the world in general is constantly evolving, and especially in nursing and in healthcare, as new science becomes evident, it's important for us to stay abreast of those changes. So I went back to school to the University of Texas of Austin, or at Austin. And I got my Bachelor's of Science in Nursing, which is abbreviated BSN. I worked full-time as a nurse here at the hospital while I attended school. It was very doable. I did clinical experiences, which is like on-the-job training with public health and my manager. So just experience in management and leadership. And I graduated there in 2013. And currently, I've decided that I need to get another degree. I just have some blank space on my wall. So I'm actually back in school right now at the University of Texas, Arlington, and I'm getting my Master's of Science in Nursing Education. And I'm currently working full time. The course is entirely online. And I'm able just to work on it a few hours a night after my kids go to bed. And I'll graduate whenever I decide to graduate. The nice thing is that since I am employed with a healthcare organization, they are providing tuition reimbursement. So I'm doing this degree totally for free. Like I'm not paying a dime for it. So I'm just going to go as slow as the tuition reimbursement will let me. So to give y'all an understanding of the role of the registered nurse, so of course we care for others. We get to make a difference in their lives. When people are in the hospital, they are at their most vulnerable. They lose all control when they come in here. We give them a gown without a backside to wear. We take all of their medications. We put all their belongings away. They have a TV, and then they can control what they order for meals. And that's pretty much it. So the nurse is the one that really gets to spend the time with them, take care of them, and really make a difference for them. We really are the backbone of the healthcare system. There are millions of nurses. Whenever you walk into a hospital, the majority of people that you see there are nurses. For most of our most hospitals in town, nurses all wear Navy. So if you ever walk into a hospital and you see a bunch of people in navy blue, it's probably a nurse. So you can see how many of us there are. I also like to consider us as the travel agent for all the other departments and doctors. So whether you're a nurse in a hospital or a clinic or wherever, you're coordinating all sorts of different things for that patient. You are that patient's primary advocate. In a hospital, you spend 12 hours with them. So y'all get to be really close, and you get to basically like act as the gatekeeper for who gets to go into that room when things happen. And you're also communicating with people for when things go wrong or when you need something for the patient. We also get to help prevent disease. Nurses provide a lot of education. We provide education in the community. Also just in general, like how do I prevent from getting something. How do you prevent from getting COVID? Nurses were at the forefront of that. We said, hey guys, you really should be wearing a mask. Okay. And we all set that example. And we wear masks all the time, like even still out in public. I'm one of the few people that's wearing a mask, it feels like. We also help to save lives. That's probably the neatest thing that we get to do. Like I said, we see people when they're most vulnerable. We see people at their worst. So sometimes we are literally saving their life. They have literally died and we are doing compressions and bringing them back to life. Like, how cool is that? It's really neat. And also we get to help patients and families cope with their illness, because sometimes things are really hard to comprehend. It's hard to learn that you have a new diagnosis or a really scary diagnosis. So we're there to hold their hands and help them understand things. You'll find nurses in lots of different workplaces, and this list is not exhaustive. There are more places that nurses can work than just what's on my screen. So the biggest place nurses work is hospitals. You'll also see us in emergency rooms. So whether it's an emergency room in a hospital or a standalone emergency room, those are all the rage right now. Where you'll see lots of little just emergency departments. And that makes sense because we only admit like 10 to 15% of people that walk through the door of an emergency room. A lot of that stuff can be handled and then the patient is discharged out back into their home. Nurses work in surgery. There's surgical hospitals where they only do surgery and then take patients home right away. They are of course, there's operating rooms within the hospitals. You might see us in doctor's offices. So whenever we call the doctor, whenever as a patient you call a doctor's office and you say, hey, I'm having this issue, you're probably talking to a nurse. Nursing homes, where people go whenever they can no longer take care of themselves or they need some extra care for a little while. I'm sure y'all have, or you may have heard of Starflight. That is the helicopter, or the helicopters. I believe there's like 3 or 4 of them. But whenever there's like a really bad car accident or we need to transfer a patient that's really has life-threatening problems from a remote site or a location to one of our trauma facilities, we use Starflight. It stands for Shock Trauma Air Rescue. My brother actually got to go in Starflight one time. He had to be transferred from a hospital, a kind of a rural hospital, down to what used to be Brackenridge. And it was 5 o'clock traffic. So he had to get there real fast. So he took Starflight down there. It is very expensive, but it was really great because his life could have turned out differently. Also in schools, you all have a school nurse, right? So that we can be in schools, in the military. Also, we have home, you can be a nurse in a home. You can be a home health nurse. You can see lots of patients a day. You can take care of one patient for an entire day. I actually did home health for a little while, which we'll talk about in a little bit. You can be on a cruise ship, and there's lots more places you can be a nurse. I used to always joke when I was younger that I was going to be a rodeo nurse so I could take care of those cowboys after they fell off the bulls. I don't know, it didn't work out, but it's fine. Some valuable skills that you should have if you want to become a nurse. You have to be decent at math. So we do a lot of math. We do algebra a little bit. But we don't do any geometry. So you don't have to worry about that. That was my least favorite subject in school. I did not do well. But you do need to be good at math so you don't accidentally give your patient a gallon of cough syrup. You do have to have some interest in science. So we have to know all the moving parts of our bodies. And so it's really important to have an understanding of what the different elements do in your body, and how medications affect the body, and what's going on whenever a lab result looks wonky. Like, it's important to know those things. You need to have excellent communication skills. So like, communication is the foundation for everything, really in life. It's the foundation for everything. So we are communicating with people, like I said, at their worst. So we have to make sure we're communicating with them and communicating with physicians and other providers that are providing care for patients. You also need the ability to build relationships. This is my entire nursing philosophy is built around relationship building. If you're having a bad day, it's nice to have a friend nearby that you can lean on to help you out, or that you can go and talk to or vent to or whatever. It's also important to build relationships with your patients and also people that you're working with. just makes your life a lot easier, and it makes the patient's life a lot easier, which is ultimately what we're here for. You do need to work well with a team. So we do not work like just by ourselves. A nurse doesn't. We have to rely on others around us, so there's no way we'd be able to get a job done. We lift patients. I don't know, I am not strong enough to lift a 200-pound person by myself, but when I have some friends to help me, it makes things a lot easier. You need to have good customer service. And this is kind of a shift over the past 15 years in the nursing world or the healthcare world in general. But we have to realize we have tons of hospitals in our city. Patients can choose wherever they want to go, and we want them to come to us because we provide awesome care. And if we give them good customer service, then they will want to refer people to us and they'll want to come back to us. And that's really important. You also have to have strong ethics. So you have to have the integrity to do what's right all the time, even when nobody's watching. So if I make a mistake, giving a patient a wrong medication, I have to speak up and say, look, I did something wrong. And then we can recognize and support and figure out what happened. And then people are there to support you to get over that, because that can be really traumatizing to make a mistake like that and know that you could harm a patient. And also be okay with bodily fluids. So you are dealing with every bodily fluid possible. We've got, spit, blood, urine, stool, leakage from wounds, all sorts of things. You have to be okay with it. I've had people pass out in the hallway after seeing somebody do some wound care. You have to be okay with those things. We can't have you passing out. So I just want to give y'all a quick overview of my nursing career. And like I said, this is not atypical. So a lot of nurses, especially those that want to advance within the field, this is pretty common. So I work at Seton Northwest Hospital. I've been here since I was a brand new nurse. I started in June 2007. We care only for adults. We see patients 16 and up. I would be what we call a floor nurse. So I'm assigned patients, assigned a group of 4 to 5 patients on the floor. And I just take care of them for an entire day. So I was able to advance up, we call it a clinical ladder. So I was able to advance up that clinical ladder by becoming a trainer for new nurses. So when you're new at something, I don't know if any of y'all have jobs, but when you're new, you have to have somebody train you on what to do so that you don't make mistakes and you know how to follow the policies and you know how to use the equipment. So that's what I did. I was a floor nurse that trained new floor nurses. I also was a member of lots of committees. It's important to get involved in a work to help you be engaged. Whenever you have an engaged employee and when you're engaged, you want the unit to be successful. And in turn, that makes your care better for patients. So I was on committees to help prevent falls, help prevent bed sores, which whenever you lay in bed for too long, like if you're leaning on your elbow for a long time, you get a red spot. If you do that for too long, like 2 hours, you can actually get a sore that starts to develop there. So I was on a team that helped to prevent those sores, and also something called Nursing Congress, which is kind of like student council, where we help to make policies and procedures that affect all the nurses in our network. I also was a charge nurse. So we basically are like the leader of the floor that day. So we make sure that all of our nurses are taken care of, that they are able to provide the care they need for the patients. We're kind of the experts on the unit. Usually we're more experienced. We deal with any issues that are happening because people get unhappy. And so we have to deal with people that are unhappy, respond to any emergencies. If a patient doesn't have a heartbeat, they're not breathing, then we have to help initiate CPR. After that, I was a nursing supervisor. So I did a lot of the same things as a charge nurse, but I also could handle like employee relations issues. So like you may have heard a term like human relations or HR, no, human resources. Sorry, I knew that didn't sound right. Human resources or HR, we kind of could handle some of those things alongside the manager. I also played manager for a short period of time, helped deal with budgetary issues, staffing, patient and staff satisfaction. And I quickly learned that was not the job for me. I did not like being responsible for firing people or those types of things. So at that point, I knew that the direction I wanted to go was to become an educator, which is what I do now. And I get to do 2 of my favorite things, which are teaching and taking care of others. So I take care of the staff that takes care of our patients, which is really neat. So I get to teach them basically any new things that come down the pipeline, and just teach them how to be nurses, and it's really neat. When I started back in 2007, my starting pay was about $21 an hour, and that rate has gone up, of course, and now it's somewhere near like $27 to $30 an hour. One nice thing about working in a hospital is that I only work 3 days a week. So I have 4 days a week I can do whatever. Well, guess what I did during that time? I spent all of my money, right? So I needed a second job. So again, this is not uncommon for nurses to have more than one job. So I started in home health. I did it for just about a year, and I took care of patients in their homes. So usually I would just go in for a quick visit. I would do some education. I might care for their wound. I might give shots. I might draw blood. And when I was there, I got paid per visit. So if I was bringing in a new patient or an admission, I would get paid more money than if I just saw them for a regular visit, like just a 30-minute visit. I would get paid $25. Whereas an admission, I would get paid like $60. So depending on how many patients you had to see, you can make some really good money there. It was not for me. I did not like having all the resources there for me, like I do at a hospital, but it was a really great experience, and it gave me a lot of insight for what the patients whenever we discharge a patient home, a lot of times we'll send them home with home health. So it gave me a lot of insight as to what they experience after they leave the hospital. So I left there, kind of just hung out, spent more money. And then I decided to get another second job. A friend of mine was like, hey, Stephanie, I've got this great job. You'd be perfect for it. And so I got to go work at Texas Oncology. And they are a doctor's office that takes care of patients with cancer. So I had just a couple of responsibilities there. So you can see a picture, and this might be kind of a hard concept to understand, so don't feel upset if you don't understand it. But patients that are receiving chemotherapy, which is like a poison almost that's going into their body, they have these special things under their skin that's called a portacap. So if you've ever gotten like an IV where they stick like a little needle in your arm and they give you IV fluids or something, it's like that, but it goes in their chest. It's got a long tube that empties into their heart. And that allows us to give chemotherapy safely without harming their arms or their veins in their arms. So you notice that little thing is under their skin. You have to stick a needle in it so you can get meds, and you can draw blood. So I access those with a needle all day long. I would just stab people with needles in their chest, right? And access those, draw blood, give medications. I helped call patients and give them their test results. Usually they were really good test results, and I got to tell them that their scans came back cancer-free, which was always really exciting. I got to answer phone calls, refill prescriptions, and I made pretty good money there for the time, which was about $30 an hour. And I did that about 2 days a week. My job status was PRN, which means like as needed. And so I basically made my own schedule, told them when I would be there. If I didn't want to work a week, I didn't have to. And the more I worked, of course, the more money I made. So that was really great. And just for the record, it's not all about the money. It's not, but I'd like to give you guys an idea of what, in reality, what a nurse makes. So there's a lot of room for growth in the nursing world. And so if you are like, you know what, I want to make a lot of money one day, like go on that trajectory, figure out what you want to do. You'll hear a lot of nurses say, oh, I want to be a CRNA, which is a certified registered nurse anesthetist. And that's really where some of the big bucks are. They work with anesthesiologists to put patients to sleep before they have surgeries. You'll also hear nurses say, I want to become a nurse practitioner. That's working alongside a doctor. You get to prescribe medications, very similar to being a doctor. So there's lots of different trajectories that you can take depending on the amount of responsibility you want to have. I don't want that much responsibility, so I'm really happy where I'm at right now. So if you were interested in becoming a nurse, I definitely recommend if your school district offers health science technology or any health related courses, definitely take some of those if you can. Volunteer in healthcare. We allow high schoolers to volunteer in our organization, college students. We even have volunteers after they've retired from working. So definitely volunteer in healthcare. It helps you get exposed to the workings of the hospital and also helps you make connections. So if you're like, you know what, I think I want to work in a hospital one day. And we're like, great. When you graduate high school, bring us your resume apply for a job and we'll get you a job as a patient care technician here. So that way you can get your foot in the door and get some really valuable experience. If you're able to do dual credit courses at ACC, I highly recommend that. At the time, my school district didn't offer that back in the early 2000s. So I didn't have the opportunity to take classes, but if I did, I definitely would have, because it would have saved me probably at least a year, and I would have gotten to nursing school a lot faster. If you can, work as a patient care technician or a certified nurse's aide or a medical assistant or some role within healthcare where you are helping patients like at the bedside, like you are touching patients, that is really a great place to get started as well, to get some experience. If you decide that nursing is really where you want to go, research schools. We have lots of great local options. I am forever indebted to Austin Community College because they provided me with an amazing foundation for my career. We have hired so many nurses from ACC and they are all high quality nurses. They've really got it down. You've got UT Austin here, you've got Concordia. There's lots of online programs. The University of Texas Arlington now has an online bachelor's degree program where you can get your BSN in 18 months, which is just unheard of. And of course, this is all after prerequisites. Texas Tech has an online program. And don't think also that just because you go to school, say you go to school and get a degree in psychology, and then you graduate and you're like, what am I going to do with this? That just having a bachelor's degree is really helpful, because now you can, you're actually like kind of a step ahead of other people, and you can get into alternate entry programs, which are a little bit faster path to nursing if you already have a degree in something else. So yeah, and decide on what degree path you want to take. So most facilities, I can't really think of any facilities that don't hire associate degree nurses. There was a period of time where the American Nurses Association had said like, oh, hey, you need to have 80% of your staff be bachelors of science in nursing prepared. So you need to have bachelor's degrees. And that didn't go well because we were turning away really amazing associates prepared nurses. So now really, whatever degree you get is very, it's hireable. It is desirable no matter where you go. So you have your associates, you've got your bachelor's, you've got your master's, and eventually there's a doctorate. That's a lot of work. If you want to do that, that's amazing. That's usually whenever people want to become professors. So yeah, so here is kind of a layout of the degree options. So for the Associate Applied Science, it's about 1.5 years for prerequisites, followed by 4 semesters of nursing school. In the Bachelor of Science in Nursing program, you have 2 years of prerequisites. You take a little bit more. In the Associates program, you're not required to have chemistry, and I think biology and statistics. There might be another one too. I think it's like a history class. So you're not required to have those, but the bachelor's degree program does. So 2 years of prerequisites and then 4 semesters of nursing school. But their nursing program includes more leadership and public health classes than associate's program does. And then there's the Master's of Science in Nursing, and you already have to have an associate's or a bachelor's degree to enter that. And your bachelor's, again, does not have to be in nursing. It can be in anything. And then it's 1 to 3 years in whatever specialized field you want. So like I'm doing a master's in education because education is my focus, but there's also administration. And if you wanted to go into leadership, you could also be a nurse practitioner. And there's several different types of nurse practitioners. Like there's neonatal to take care of babies. There's family nurse practitioner that it can take care of people across the entire spectrum. So from, an infant all the way up to death. And then there's also like psychiatric where they deal with mental health. So lots of options. The average nurse salary in Texas is about $72,000. Starting out, it'll be about $50,000, give or take a little bit. And like I said, depending on what trajectory you want to take, if you want to become a nurse practitioner, you can make well over $120,000 a year. Some of the pros and cons of nursing. So pros, flexible scheduling and places to work. Like I said, if you don't like it one place, you can always go somewhere else. That's the wonderful thing. I love the flexible scheduling. When I was a lot younger, I didn't have a family. It was really nice to get to, like, I could work 3 shifts, be off for 6 or 7 days, and then work another 3 shifts and meet all of my working requirements. You can specialize in an area that you love. So if you're like, I really want to take care of patients with cancer, you can do that. There's hospital units just for that, or you can work at a place like Texas Oncology. If you're a hospital nurse, like I said, you work 3 days a week. That's pretty awesome to work 3 days a week. It's amazing. You get to you can use less vacation time because you can plan your schedule around going on a vacation, or just take some time off and go spend all your money like I do. You get a good salary. You can help others and make a difference in their lives, which is really the most rewarding part of it all. And saving lives. It's pretty amazing too. We are considered the most trusted profession. Like over 16 years running. There was 1 year we didn't get it, but we are back there, man. Like that was really disappointing. The 1 year we weren't the most trusted profession. You get to wear your pajamas to work. Like scrubs are the most comfortable thing in the world. You get to learn some really cool skills. You get to stab people with needles. You get to put tubes in places you didn't think they need to go. Like you get to do some really, really neat stuff. And just there's a really great sense of appreciation for being a nurse. And that's really good for your heart and soul, I think. Some cons, it is hard work. It's not easy. I assure you of that. Will be tired. There will be days you are crying. It's not just that it's hard work. It can be emotionally draining because you are with patients for 12 hours a day, sometimes 3 days in a row, and you become really attached to them. And if something bad were to happen, or maybe they were to pass away, like it can really affect you and make you really sad. So it can be really emotionally draining too. You do have to deal with bodily fluids. I've had to change my scrubs more than once. I mean, it is what it is. The days are long. 12 hours is a long time. So sometimes, like in the winter especially, you come in the dark and you go home in the dark. But again, you're only doing those 3 days a week. You do have to work holidays and weekends, especially if you're working in the hospital. But it's not like you work every single holiday or every single weekend. They usually say like, okay, you have to work 2 holidays and every other weekend. So it's really not that terrible. And usually the weekends are a lot quieter. And so it's really nice to be able to work on those days. There is lots of charting. Our society is a very litigious society. So things go to court, okay? So we have to document everything that we do. Because if we didn't document it, it means we didn't do it. So if they pull a chart because a patient has sued a hospital for some reason, we need to be able to stand behind what we documented. And if they're like, oh, well, we see right here, you didn't document this. And you're like, well, shoot. I guess it didn't happen then because I don't remember because I took care of that patient 3 years ago. So lots of charting. And of course, it can be stressful at times. The kind of con to saving people's lives and helping others means that sometimes those are some really intense moments, like doing CPR on a patient. That's really stressful. It's really, really stressful. Their life is literally on the line, and you're doing your best to save it. That is it. Okay, so I know that Josh has some questions, so I'm going to stop sharing my screen. Okay.
Awesome. That was a great presentation. I really appreciate it. And, you know, it's so funny. I've never known the difference between a charge nurse and a nurse supervisor. So that was a huge tidbit, as well as the Starflight. I never knew what that acronym meant. So,
oh, I totally learned it from the radio. So don't pretend. I'm not going to pretend like I knew that before.
That's awesome. Yeah, I see them flying over my house all the time in South Austin. And I'm like, oh, yeah, there's Starflight. But now I can say, well, I know what it means.
Yep.
Well, thank you for sharing all that. And, you know, Stephanie, as I mentioned, you covered a lot of this information, but I did want to just touch on a few of these questions. I feel like you did an awesome job talking about education and some opportunities. Could you tell me just a little bit about the possibility of maybe doing like a CNA track before you become an RN? Do you see some people do that? Because that could be another way to make some money and slowly work up. Could you tell us a little bit about that?
Yeah, absolutely. So a CNA is a certified nurse's aide, and they basically do things like take vital signs and give patients baths, and sometimes they can be certified to pass medications. They also can be trained to insert IVs. So some places require a CNA certification in order to work as a nurse's aide. One nice thing with Ascension is that we call them patient care technicians, and we do on-the-job training. And that's a lot of places can have that on-the-job training. But by going through the CNA program, you get a level set base foundation of education so that you have, we call it like the evidence or the science behind why you do the things. And it's actually really desirable to have your CNA license, especially if you're brand new trying to get into an organization. And you can work like 3 days a week. You can work 1 day a week. You can work, 3 days and 6 weeks. It doesn't matter if you wanted to go into nursing school. So CNA is a great way to get into it, especially if you've never been exposed to healthcare before.
Awesome. Thanks. I appreciate it. And,
Oh,
go ahead. Yeah.
sorry, and one more thing. If you are working as a CNA within an organization, you could probably get tuition reimbursement as well, which is always a perk.
And you bring up such a good point that there's opportunities to start as a CNA, bridge to an RN, bridge to that BSN, and even go on to do that master's, really utilizing some of those tuition reimbursement programs and training outside of the normal workday. So I think there's some fabulous opportunities there to really make this approach to becoming a nurse much more affordable. So I think that's an awesome approach. Stephanie, you talked a lot about the fact that you've used the community college system as well as UT Austin and UT Arlington as your kind of base for your education. And I know sometimes if you don't have tuition reimbursement, that can be kind of expensive. Do you have any suggestions of other ways outside of tuition reimbursement to maybe make that cost of education more affordable?
Yeah, absolutely. So like if you go to ACC, you can get your entire nursing career, including your prerequisites, for $9,000. Okay, very affordable. ACC understands that people are entering their programs that might not have amazing financial means, and they might not want to take on student loans. So they have a lot of like work school options. There's something called Capital Idea, where they help you pay for nursing school and give you money to live. Because we know that if you're going to be successful in school, you're going to be a successful member of society, right? You're going to contribute as a member of society. And so they know that by giving you money to do those things, it'll help you out in the long run. There's also scholarships available. When I went back for my bachelor's degree, I was able to get a scholarship from my employer and through the school. You can apply for those. I mean, unfortunately, there's also student loans. I did have to take out some student loans for my bachelor's degree, and I'm still paying on them 7 years later. But it's really okay. I mean, it's a minimal amount every month. So there are definitely ways to offset those costs. And some of the programs in the area are much more expensive than others. That's why I really like to promote the community college option, just because it is so much more affordable. Like if you were to go to Concordia, I think it's something like $40,000 a year. It's a lot of money. So whenever you can get your entire program for $9,000, I highly recommend that.
That's awesome. And I appreciate the plug for community college, because I really do think that is a much, much more affordable pathway to beginning that career. And of course, when you go on to maybe do the bachelor's and the master's, you're going to have to go to a 4-year university to do that. But those are great options to look into. My final question, just looking at this one, is nursing school stressful? You talked about all these years of education plus that board exam to do the NCLEX. We don't know what it means, but that NCLEX is it's not an easy test. So can you tell us a little bit about that experience?
Yes, I am not going to lie to you and tell you it is not stressful. It is probably the most stressful 2 years of my life so far. I was like 21, 22, 23 whenever I was in nursing school. I was at like my prime. I wanted to go out. I wanted to be with my friends. And so I just kind of like made a deal with myself that I allowed myself to be a human 1 day a week, 1 night a week, and just made sure that I had somewhat of a social life so I didn't go crazy. I will tell you, like I said, I was young. I was right out of high school. I did not have a family, didn't have any kids. So it was definitely a lot less stressful for me, I think, than the people that did have children, but not totally undoable. But yes, it is stressful. You have to study like crazy. You have to memorize things like crazy. And it's not just about memorization. It's about understanding how to apply the concepts that you're learning to how it's functioning within a human body. So yes, it is very stressful. The NCLEX is definitely the most stressful test I've ever taken in my life. And they say the harder it is, the better you're doing at it. So I like to think I was doing really good. I don't know.
It's awesome. And I appreciate your honesty about that. And some of the things too I've talked about with other nurses in the past is sometimes just the challenge of getting into nursing school because of spots available. So let's say you start, maybe a college pathway to do this and you don't get into nursing school. What do you suggest doing in order to make yourself a little bit more marketable to maybe get into nursing school that next year?
Yeah, great question. So if you score poorly in a course, like maybe you make a C in a course, I would definitely retake it to try to get the A. I have techs that I work with here at the hospital, and that's what they do. If they like, because some of them, they started the whole nursing school process years ago, and then just life happened, and they're like, well, shoot, I was 19 when I took that class, and I got a C or a D, and now it's affecting me now. So I'm going to go ahead and take that class so that I can get a better chance of getting into nursing school. And a lot of nursing schools, they have just a waiting list because they only have a certain number of spots they can take because we only have so many hospitals in the area. So a little bit of background on that. So hospitals will only allow a certain number of students in them at a time. And they can't have more than one school within a hospital really at the same time. So like on my floor, I couldn't have UT students and ACC students here at the same time. I can only have 6 students from one school here at a time. And they have a certain number of hours that they have to be in the clinical experience. So say in a 16-week semester, they have to be in a hospital for 135 hours. Okay, so that makes it really difficult. It's like Tetris trying to fit all the schools in. So they can only take as many students as they have clinical spaces. So getting on that waiting list early with good grades is really important. Because the waiting list, the longer you're on it, the higher your grades are, the more likely you are to get into nursing school because it's all ranked. And all of those things go into the rankings, the amount of time you're on it and your grades.
I think that's great advice. And, if any of you all are taking or plan to take dual credit courses, it also applies to those dual credit courses.
Mm-hmm.
You've got to have good grades on those. So really take those seriously because that means later on you may not have to take that course again if you get a good grade on it. So there's a lot to be said about that.
Mm-hmm.
All right. I think you did a really nice job talking about the importance of how to prepare if you're a teenager of taking advantage of some of those dual credit courses and getting into those health science courses. And I do encourage a lot of you too to consider, if your school is going to start a HOSA chapter or Health Occupation Students of America chapter, to take advantage of that. And I really love the typical workday. I think you did a nice job about that. But let's look at this last bullet about the typical patient that you would see. We talk a lot in this class, and you mentioned the importance of professional skills such as communication and customer service and things like that. And we talk about a lot of those skills in this class. But can you tell us about kind of the typical patient that you would see, and let's say maybe on a nursing floor that you worked on, and then we can dive into maybe how to deal with those difficult patients.
Yeah, sure. So it's hard to just pinpoint exactly one type of typical patient, but let me kind of give you types that you might see. So you might see an elderly patient with dementia. So they don't remember things. You're telling them the same thing over and over and over again. And they might have pneumonia. Okay, so we're treating them with IV antibiotics. We're giving them IV fluids, and we're trying to keep them safe so they don't climb out of bed and fall and hurt themselves. So that's one type. As far as like your kind of middle-aged to older adult, they might come in with something like diabetes issues. Maybe they got a sore on their foot. Whenever you have diabetes, you have healing problems. So maybe they have a sore on their foot and we're treating them for that sore. Or maybe they have a issue with their stomach. So we're treating them for that. Like younger adults, you might see them come in. You might have a trauma, like maybe they fell and broke their leg and had to have surgery on that. Or maybe they got an infection. Like I'm sure, or you may have heard of something called MRSA, which is methicillin resistant Staph aureus. It's a type of bacteria that's resistant to certain antibiotics. So if people have that, they have to come in and get treated with antibiotics. We also have people that come in for planned surgeries. When you get older, sometimes you need like a knee replacement or a hip replacement. So you see patients like that. So it's really a huge variety of things that you see. And depending on the hospital that you're at, depends on the types of patients that you see. So like if you're at Seton, you might see somebody that sawed off their arm with a chainsaw. Okay. But here, thankfully, we don't see that, but we might see like grandma fell and broke her hip and now has to have surgery to fix it. So it's a really wide variety. For the most part, patients are very kind and very grateful, and they treat you very well. But of course, occasionally you do have those difficult patients and difficult families. So I can go ahead and talk about that.
Yeah, if you wouldn't mind talking about that and how you handle that conflict, because conflict resolution can be a big part of your job when working with those difficult families and patients.
Yeah, absolutely. So a lot of times when there's a conflict, it's because people do not feel like they are being heard. So the first thing that we do is we just stop and listen and see what's really the root of the problem. As I mentioned earlier, when people come into the hospital, I keep using that as an example because that's just the best place I know. But when people come into the hospital, we take away all control from them. And we're not just in their room sitting waiting for them, right? Waiting for them to need us for something. We usually have several other patients that we are assigned, and we are taking care of them as well. So they might be upset because we were late with their pain medications. So really, we just like sit and listen. I am so sorry that you feel that way. This is what we're going to do for the future and figure out a plan to fix it and try to solve the problem in the moment as much as you can. If you aren't able to solve the problem, you have a chain of command that you go up. So first you would go to your charge nurse, and then you would go to your manager, and you might need to take it up the chain of command even further. But really just trying to figure out what the problem is. Now, sometimes we have patients that are totally unreasonable. We get a lot of patients that have alcohol abuse and they're withdrawing from alcohol. And when that happens, people can be really mean. And it's not very pretty, but it's part of it. It's dangerous for people to withdraw from alcohol by themselves because they can have seizures and they could actually die from it. Not to be dramatic, but it's really what can happen. And so sometimes it's just setting those boundaries, like saying, we will not let you treat us this way. And if you do, this is what's going to happen. So yeah, a lot of it is just laying out expectations, like, here's what you can expect from us. I expect you to treat me like a professional. So there's all sorts of different types of difficult family and patient situations. And sometimes it's setting those boundaries with family members as well. Healthcare is an emotionally volatile area. So people can get really emotional because they're scared and they're afraid. And so we have to have an understanding for that. And we have to always try to prevent anger from occurring. We don't want people to always be upset, right? So the way we try to prevent those things and communicate with them. And like I said, communication is really the most important thing. So if we can communicate with the family and tell them, like, look, this is the plan for the day, and I will call you if anything changes, that can really help circumvent any of those issues that might occur.
That is great advice. And I really like how you emphasize the importance of active listening and really listening to the concerns of the patient, coming up with strategies to help them, setting boundaries when it's necessary so that you aren't treated poorly. And then, of course, the power of communication and really emphasizing all of the treatments and different things that you are carrying out with the patient. So I think that is great advice. And, I think that's the foundation of many of the professional skills we practice in our classes in high school. So thanks for sharing, Stephanie.
Yeah, absolutely.
Let's see. All right. And I think you did a nice job talking about the rewards and the challenges about nursing. Of course, I think every nurse says that charting is one of the hardest pieces of it that I hear. I have a lot of friends who are nurses, but and you did a really nice job of kind of talking about how salary does increase with that additional education. So there are opportunities, of course, to grow and get a higher salary as your career does kind of excel to the next level. I did want to take this time to just open up to the groups for you to ask some questions. And I had one question that Jocelyn sent me through the chat. And her question goes back to nursing education, Stephanie. And she was asking, what are the required grades for nursing school? Do you need all A's or B's okay? Is it okay to have a C here and there? What are your thoughts on that?
Yeah, so overall GPA definitely should not be less than 3. Anything higher, of course, is going to give you a boost. And fun fact, when you're in nursing school, it is not a typical like an A is a 90 to a 100 and a B is an 80 to an 89. If you get below a 75, you fail. So you like a C is like a 75 to an 81. And a B is like it's like an 82 to a 91. So the grade scale is a little bit different. Fun fact there. So I would definitely say strive for A's and B's, and you will be in a much better position than if you start scoring lower. Okay. I know like in my master's program, for instance, if our GPA drops below a 3.0, like within master's degree classes, so they don't care about the rest of my GPA. Just for the master's degree classes, if I drop below a 3.0, I am dismissed from the program. So it's really important to maintain those good grades. And it's possible, you just have to commit to it, and figure out a good way to study and remember things. I still have all these crazy acronyms that I made up when I was in nursing school so that I could remember things. Like you have to remember side effects of all different medications and the stages of grief and all sorts of different things. And I still have these acronyms floating around in my head that help me remember things. So
that is great advice. And yes, the A's and B's, it is just absolutely crucial. And, if any of you all are going to be taking dual credit courses, even in your dual credit or AP courses, such as English or your math classes and things like that, you still want to get those A's and those B's and really strive for a high grade on the AP exam, because ultimately that could play into you completing some of those base classes that you need to complete in college before you get into nursing school. And that's definitely something to think about. What other questions do you all have in the audience? Any others? I'm just going to pause for a second here. Okay, let's see. Chat box is coming up here.
Yep.
Sorry if I can get the right buttons to work. There we go. What are the daily problems you run into at work? That's a great question, Ashley. What are your thoughts on that, Stephanie?
So really the unexpected things are the problem. Like your patient who is doing great has unexpectedly started having nausea and vomiting. Like, shoot, now I've got to go chase that. Or technology issues, like, oh man, my computer's not working right, or my phone's not working right. Or delays or things that are out of your control. So maybe your patient is supposed to go to surgery at noon, and now they've pushed it back to 4 o'clock, and that's stressful for everyone because your patient hasn't eaten since midnight. So it's just kind of those unexpected things that make it really difficult. Those are usually the types of issues that we run into. And, like we mentioned a little bit ago, difficult patients and family members are, of course, problems that we can run into. And yeah, it's pretty much the majority.
And then Jocelyn, you can answer this however you want and divulge as much as you want. But Jocelyn had a question about the amount of money being paid. Is it enough or fair? And I think it's important to think about this from the context too of Austin becoming a more expensive town. Any thoughts on that? Especially, let's say, from a starting position, maybe as a nurse who's just beginning their career.
Yeah, I mean, I'm always going to say no. I don't think nurses or teachers get paid enough. I really don't. Like, literally saving people's lives, right? And I mean, you can get up there in salary pretty quickly, depending on what you decide to do. And there's always differentials for doing more things, but I always feel like we could get paid more. Like, to me, I feel like somebody with a degree that is providing care for patients at their worst should definitely get paid more money. Yeah, that's really hard. Exactly what? I don't know. But I definitely do feel that way. Everybody in healthcare needs to. But unfortunately, especially we work at a nonprofit organization, so we are limited to the money that we can spend on employees based on the money that we get from reimbursement from insurance companies. So that all that money has to be divvied up everywhere. So it's really hard to be like, oh yes, nurses will make $100 an hour and then still be able to run a business with all the working parts that you need. So I understand that there's not always a ton of space to make more money, but I sure wish we did.
Yeah, definitely
Yeah.
understand. So Lucia, you had a question about the university Stephanie attended. So Stephanie did her registered nursing degree, her ADN, excuse me, the associates in nursing at ACC, and then she did her bachelor's at the University of Texas at Austin, and she's currently working on her master's at University of Texas at Arlington. So yeah, so it's pretty cool. And then Ashley had a question. What are some things you wish you knew before that you know now? So is there anything like any imparting wisdom you can leave us with that you would say, man, I wish I would have knew that at the beginning of my career or in high school, and I could have prepared myself better for that?
Oh, wow. That's a really
It's a loaded question.
There's just so much.
That's a good question.
Yeah. That's a really great question, Ashley. Oh my gosh. I mean, I wish I would have known more about the business side of things going into becoming a nurse, because I think it would have saved me from feeling a lot of the discomfort of working for a corporation, right? Like they always talk about working for the man. I mean, most of us work for the man, right? And so I think having an understanding of how even working in a hospital as a business is really important. That would have saved me a lot of stress before when I didn't understand why things happened. I also wish I would have known what it was like to be a patient in a hospital bed before I became a nurse. I didn't really have as much of an appreciation for it until I was a patient myself when I had my children. Gives you a totally different perspective on treating your patients like they're your family members. Like we always say that, and that's what we want to do. And I don't think you can appreciate that as much until you've been in that bed. So those are some things.
Yeah, that's great advice, and I love your thoughts on being, having that kind of understanding of the business side of it, because I feel like in healthcare and I work in education, it's extremely complicated, and funding streams and insurance is just hard to kind of deal with. And in our health science classes in high school, we're going to talk about some of those things and how you get kind of an overview of what that sort of looks like, from your perspective. And then, of course, hopefully, as you all go through your classes in the future, you'll get to learn a little bit more. Well, Stephanie, we've come up on kind of our hour here. Any imparting words that you'd like to give to the group before we depart for the day?
Yeah, I just want to say thank you so much for having me. If you are that friend in your friend group that is the responsible one, that is always taking care of others, you should probably be a nurse, okay? You probably would have a great career in that. So if y'all ever have any other questions, please, reach out to Josh, and he can reach out to me, and I'm happy to, hook you up with whatever I can. So thanks for having me.
Well, I appreciate it. And thanks again, Stephanie, for joining us today. And I am going to be sending this video off to Workforce Solutions, and then it will eventually be posted on their Climb the Ladder CTX page and their YouTube channel as well for others to view. So if any of you all know of anybody else who wants to be a nurse, show them this video. They can check it out a little bit. So I wish you all a great rest of the day. And Stephanie, thank you again for your time. We really appreciate it.
Thank you so much. You'll have a great rest of your summer.
Bye.
All right. Bye-bye.